Today I am joined by Dr. John Baker. He's a family physician with AnMed in Anderson. So thank you so much for joining us today.
You're welcome.
And today we want to discuss the flu, respiratory illnesses. We know there's a lot of things going on right now, going around. DHEC, their most recent numbers were in the double digits for flu deaths and in the triple digits for hospitalizations. So let's talk with what you've been seeing so far in your own practice over the last few weeks.
Yes, I'm the medical director at AnMed Health Care Connect. Is our urgent care. And so we've been seeing a great uptick of respiratory illnesses since Thanksgiving. However, in the 3 weeks of December, we really saw a large amount of influenza, even greater than COVID cases that came into our clinic.
Wow. So you're saying more flu cases than COVID cases currently?
Yes, that's correct.
Yeah.
It is a difficulty for physicians as well, because patients who present often have very similar respiratory complaints for flu, COVID, and then other minor viruses like adenovirus or coronavirus that can cause a common cold.
And school's starting back up for a lot of students tomorrow. Some of them actually started today. So what advice do you have for parents if they're sending their kids back to school and they're a little bit worried that maybe they'll catch one of the viruses going around?
Yeah, the most important thing is to not send your child to school if they have a fever. If they have a temperature, greater than 100.5, they need to stay home until they do not have fever. Certainly, if they have symptoms for less than 48 hours, they should contact their primary care physician, pediatrician, and see if they need testing for flu. Certainly, that's a good treatment to begin oseltamivir or Tamiflu within 48 hours. It does reduce symptoms, usually by 1 day of total symptoms, and also it can reduce, the severity of the symptoms.
Do you expect the flu season to actually get worse as we go into the new year?
Yes, looking at the influenza-like illness surveillance data from DHEC shows that, we are at about 18% of total visits to practitioners across the state of flu-like type illnesses. So usually we run more around 4% and was at basically 3 to 4% at this time last year. So we're definitely seeing a higher incidence of flu in South Carolina and in the upstate particularly.
So exactly what does that 18% mean?
That means that patients, the amount of patients that are presenting to an office, maybe close to 18-20% of them are respiratory illness. They're not always all influenza, but we do seeing a lot more influenza activity.
All right. And you think it could actually continue to get even worse as January, February continues?
Yes, the curve is actually going up. It's nowhere leveled off or coming back down yet. So it's probably acting more like a more traditional flu season for South Carolina. During the times with COVID, we didn't see as much, perhaps because we were wearing our mask and washing our hands and distancing better than we are right now. So we're going to probably see this peak in January, February, and then go back down to more normal numbers in March.
All right. Well, that's about all we have time for, Dr. Baker. So thank you so much for joining us, and hopefully this helps a few parents and their kids out there.
Thank you.
All right. Thank you.